Hello, everyone, and thank you for joining us today. On behalf of International Bipolar Foundation, I would like to introduce Dr. Felice Jacka. Dr. Jacka is Associate Professor and is a Principal Research Fellow at Deakin University. She is recognized as a leading expert worldwide regarding the association between diet quality and the common mental disorders, depression, and anxiety in children, adolescents, and adults. She is president of both the International Society for Nutritional Psychiatry Research and the New Australian Alliance for the Prevention of Mental Disorders. Today, she will give an overview of the recent and compelling evidence from around the globe demonstrating the important role that diet plays in the common mental health problems, depression, and anxiety. This very new research is transforming the way these disorders are conceptualized. She will also discuss the potential for universal prevention strategies for depression and anxiety, as well as novel treatment strategies for mental disorders that incorporate dietary changes. Welcome, Dr. Jacka.
Thanks so much. It's a pleasure to be here. And hello, everyone who's listening. I hope you find this interesting. This is a very new area of research. It really sort of started, I guess, at the end of 2009. So it's in its infancy. There's many things that we don't know. There's many things that we're taking forward and testing and developing hypotheses around. But what I'm going to do today is just give an overview of the research in this area, and I'm very happy to take questions at the end because, you know, generally people have a lot of questions and sometimes we can answer them and other times we can't. But what I'll start by doing is putting this talk into a context, and this context is known as the epidemiological transition, and this is the transition away from infectious diseases such as malaria and HIV as being our greatest killers to one where the non-communicable disorders, which are otherwise known as the NCDs, are the disorders that are killing us the most. So they're responsible now for the largest burden of early mortality around the globe. And in fact, these nutrition-related disorders, many cases they're nutrition-related, now kill more people than smoking-related illnesses. And this is really a function of the way our diets have changed right around the world, which in turn is a function of what we know to be the globalization of the food industry and the predominance of the food industry. Now, these changes have resulted, as we know, in a very profound impact on our waistlines. So we've seen this very rapid increase in the prevalence of overweight and obesity in the Western world since the 1980s. So Australia, where I am, and the US and the UK, we saw this rapid escalation, and now we have about 3/4 of adults in each of those countries overweight or obese. But now the developing world is really catching up very quickly. Places such as China and Brazil and Mexico are undergoing a very rapid transition in their collective weight. And we know, for example, India is one very good example of this, although good might not be the right word to use. Now, in India, they have a bit of a genetic predisposition to gaining weight and to metabolic diseases, but suffice to say that a generation ago, a child born in India, type 2 diabetes was almost unheard of. It was really rare, whereas a child born today has a 1 in 2 chance of developing type 2 diabetes over their lifespan. And this is really a reflection of the way in which their diets have changed. And, people are having a lot more foods with added sugars and refined carbohydrates, etc. And we can see the evidence for this if we go to India or we have a look at this photograph. This is from The Economist, and looking between the 1970s and the 2000s, just showing the consumption of fresh vegetables and nutrient-dense foods declining and the increase in the consumption of, ready-made foods and foods high in fat and refined carbohydrates. We really see what we call malnubesity. There's great evidence of this even in Australia, where people, and I think particularly young people, are overweight and obese, and yet they can almost be stunted. There's evidence for shorter stature in people from poorer areas who are eating worse because they're getting lots and lots of energy, but their nutrient density is very low. And part of this relates also to a lack of fibre in the diet, which I may talk about later if we have time, but that is related to the health of the gut and the microbiota, which we're increasingly understanding is very, very important in health and disease. So our diets have really changed. If we think about, I guess, where we've come from, and genetically there's an argument that we're designed to eat like Stone Ages because our genome takes a very long time to change and evolve. And it was really only 10,000 or so years ago that we started to settle down and grow crops and stop living in caves, I guess. And if you think about things in that context, we might consider what we're designed to eat and what a Stone Age person ate. And, you know, back in the day, and of course it would vary enormously depending on where you were in the world, but I guess an ideal healthy Stone Age diet would have a very wide range of plant foods, forage plant foods, lots of wild game and fish and shellfish. And of course the wild game, a bit like the kangaroo here in Australia, you know, they're feeding on grass. They have very high levels of omega-3 fats in the meat, low levels of saturated fat. And we know that omega-3 fatty acids were very important in initiating the growth in the brains and the brain size and capacity in early humans. Fruits when they were available, and nuts and seeds. But of course, what they didn't have was also very important. Very few grains, no dairy products, no salt, and very low levels of sugar. A Stone Age person would be very excited to find a source of honey maybe, and they would go to great lengths to get it, but in general they would have very few sources of sugar. So if we compare that to our current diets, you can see that they're wildly diverse for most people. Now, there's a field of research called nutritional epidemiology, and it's been really preeminent since the 70s, you know, where a huge amount of research has gone into looking at diet and how its relation to health and disease. And there's enormous amounts of conflicting evidence. Some of that conflicting evidence arises as a result of different cultures, different methodologies, and I guess the influence of food industry and, you know, various industry influences. But suffice to say, if we look at these dietary patterns, and there's various ways of ascertaining dietary patterns, we know that a healthy diet, which is what we see in the top left, and this might look quite different in different countries. You know, a healthy diet in Spain might look very different to one in Norway, compared to one in Australia, compared to one in Japan. But what they have at their heart is a higher intake of plant foods, fibre-rich foods, nutrient-dense foods, fish, good quality meats, and so forth. This is known variously as a healthy or a prudent or a wholesome dietary pattern. The one on the bottom left, in contrast, looks pretty similar right around the world, and that's because it's usually coming from industry. And it, of course, has high levels of saturated fat, refined sugars and carbohydrates, and low levels of nutrients and fibre. And we know that if our diets look more like one or the other, this is going to influence a whole host of NCDs, so cardiovascular disease, stroke, obesity, of course, type 2 diabetes, metabolic syndrome, some forms of cancer, and increasingly we're understanding this also relates to our risk for dementia. So many people are now saying that dementia is actually an early life disease. It's really determined by, in large part, apart from the obvious role of the ApoE4 gene, by our health in our life up to the age of 30, whether or not we partake in regular exercise, whether or not we smoke, and the quality of our diets. So this is a really important area of investigation. But when I first came into psychiatric research in the mid-2000s, I was really intrigued to see that there was no equivalent evidence base around mental health. So we knew about the influence of diet on all these other things, perhaps not dementia, but certainly the other physical diseases. but there was no equivalent evidence base in mental disorders, and this is something that really I thought was intriguing and an obvious lack. So this is where I started my PhD and started to look at the links between diet and mental health. So we know the common mental disorders, depression and anxiety, are common. That's why they're called that. In Australia, at least half of people at some point in their life will experience a mental disorder, and these will predominantly be depressive and anxiety disorders. Now, these data are from a study that was part of my PhD where we looked at a large group, over 1,000 women, right across the age range, and they were highly representative of the Australian population. And we administered a detailed psychiatric assessment of all of these women, and we found that more than a third of them reported a lifetime history of any mood or anxiety disorder. So that included bipolar disorder, major depression, dysthymia, and a full range of anxiety disorders. At the time of the assessment, approximately 15% were affected. So these are very, very common disorders, and in fact depression, unipolar depression, accounts for the second highest burden of disability around the globe. So this is the study that I did for my PhD, and happily it ended up on the front cover of the American Journal of Psychiatry, and it was considered really big news at the time because we looked at women's diets and we saw that they were related to their risk for these common mental disorders. Of course, for people outside of psychiatry and for me and for many people in population health, we were surprised at the surprise because, you know, there's many reasons to think that nutrition would be related to mental health. We know that our physical health and our mental health are very tightly intertwined, and maybe looking at them separately is a bit of a bad idea. So a lot of people outside of psychiatry thought, well, gee, don't we already know this? But in psychiatry, it was considered to be quite a novel finding. So what we did with the women that I mentioned, so over 1,000 women, representative of the population, aged from the early 20s up until their 90s, we looked at their diets in great detail. We did the psychiatric interviews, and we also found out a lot of information about them to do with their other health behaviours, whether or not they smoked, whether they exercised, whether they, what their incomes were, what their level of education, all of those things, taking those into account. We looked at their diets and we saw that those women who were higher on this Western unhealthy dietary pattern were more likely to have a depressive disorder. And in contrast, women who had a more healthful dietary pattern, we call this a traditional diet. It was a bit like the, English meat and 3 veg, but higher intakes of vegetables, fruits, whole grains, fish, and good quality lean red meat, not processed meat. They were much less likely to have a depressive disorder or an anxiety disorder. So there were other findings in that study, but that was the main set of findings. So we were intrigued by this because it was very clear, the relationships. So we went on and we did more research. I do a lot of research in Norway where, they have very good quality data on the population. And, they eat a very different diet to us here in Australia, lots and lots of fish and potatoes and things like that. But again, we found that people who had healthy diets were less likely to have depression. Those who had Western unhealthy diets more likely to have anxiety. And similarly, at the same time, we saw studies coming out from around the world in other jurisdictions. So this is a study from the UK that was published pretty much at the same time. And this one looked at people prospectively. So it looked at people over about 5 years. Now, there are about 3,500 public servants, middle-aged public servants in the UK. And those who had a higher scores on this whole food, healthy dietary pattern were less likely to experience depression over the 5 years that they were followed up, whereas those who had Western unhealthy diets were more at risk of depression. And of course, in these studies, we take into account these other variables that might explain that relationship. So things like whether or not they're married, whether they're educated, what their income's like, whether or not they exercise, all those sorts of things. And these relationships seem to be quite independent of those factors, which is really important to know. This was another study done by colleagues of mine in Japan, last year or the year before, and they've done quite a lot of work looking at this, and they consistently find that people who have a healthy dietary pattern with vegetables, fruits, mushrooms, seaweed and fish are less likely to be depressed, but they also found in this very important prospective study that they had about half the risk of suicide over the period of time that they were followed up. In Spain, a colleague of mine has done a lot of research in Spain, and they followed people over time. And this is really important to do because we know that when people are depressed at the time, it can affect their appetites. So what you need to do is identify people who've not had any depression before, follow them over time and see who gets new depression. They haven't had it before. And in this case, similar to what we saw in the UK, people whose diets looked more like the traditional Mediterranean diet, which we know is a really healthy way of eating, fruit and nuts and whole grains and things, they were about half as likely to develop depression as those who had lower scores on this diet. This was also published in one of the leading journals in psychiatry research. Now, of course, we know that the average age of onset for these common mental disorders is very young. Big studies that have come out of the US tell us that the average age that an anxiety disorder starts is about 6 years old, so really, really young. And for depression, it's about 13, so very common, initiates in adolescence. And we know, in fact, that 50% of mental disorders first manifest before the age of 14 years. So with my prevention cap on, we really want to know whether diet in adolescence is related to adolescents' mental health. And we also want to know this because the diets of young people have really changed a lot. So really, we often see that older people tend to eat better. They tend to eat the way they did when they were younger, which is fewer processed foods, simpler diets, more whole foods. Whereas young people, of course, are drinking a lot of soft drink, eating a lot of these takeaway foods. So we've done a number of studies now in this field. And we're really interested because when we think about the obesity epidemic and the increases, we can also look at some of the data from adolescents and see that there seems to be an increase in the prevalence of mental health problems as well. So these are data from the UK. There's equivalent data in the US. Looking at the percentage of young people reporting frequent feelings of anxiety or depression in 1986 compared to 2006. And you can see that for boys and for girls, that prevalence has roughly doubled over that time frame. Excuse me. And of course, as I mentioned, this really tracks along with the increase in obesity that we've seen. So when I was young, young people, my peers commonly looked more like those on the left of the picture. Whereas now, if I go to a swimming pool or somewhere in the public and people are running around with their bathers on, it's amazing how many of the young people look more like that on the right. So this has happened really over the same time frame. So in this study, part of the work that I do is with the Murdoch Children's Research Centre here at the Royal Children's Hospital in Melbourne. And we looked at approximately 7,000 young people from around Australia, and they came from all walks of life, all different social backgrounds. And consistently we saw that the kids who had healthier diets were less likely to have depression. In contrast, those who had unhealthier diets with more of these sorts of foods were more likely to be depressed in adolescence. Really importantly with this study, we found that a whole host of factors that really could have influenced their diet and their mental health didn't explain these relationships. So levels of family conflict, poor family management, their levels of physical activity, and whether or not they were, indulging in strange adolescent dieting behaviours didn't seem to explain this finding. And there were very clear dose-response relationships. So the worse the diet, the more of the junk food, the higher the depression scores in these adolescents. And this was seen right around the country, right around social backgrounds, but quite independent of parental SES and income and those sorts of things. Now, these are quite young adolescents, so they were really in the main having food that they were given at home, less so under their own volition. So we went on and did another study with the WHO Collaborating Centre for Obesity Prevention. Now, this study was a prospective study. So we looked at kids at two time points in, I think from memory, 2004 and 2007, or 2007, 2009, sorry. And we got measures of their diet and their mental health at the start, and then again 2 years later. Now, what we saw at the start when we looked at their diets and we looked at their mental health, the same thing. Very clearly, those who had higher scores on this healthy dietary pattern had lower scores on the depression measure. Those who had higher scores on this unhealthy junk food diet had higher scores on the depression measure, and again, very clear dose-response relationships between them. But we wanted to know whether, if we looked at the kids' diets in 2007 and then we looked at their mental health in 2009, whether there was a link, and indeed there was, particularly with healthy foods. The kids who had healthier diets at the start had better mental health 2 years later, regardless of their mental health at the start. And very importantly, we saw that the changes over the 2 year period in the kids' diets were linked to their mental health. So kids whose diets improved over that 2 year period, their mental health improved. And the kids whose diets got worse, their mental health got worse. And we, again, didn't see what we call reverse causality. We didn't see that the kids' mental health predicted their diet. It only worked the other way around. We've gone and done studies like this in the UK, very poor areas of London, and seen that even in the background of, large amounts of substance use, low levels of family support, etc., diet still seems to be related to adolescents' mental health. So now, since 2009, we've seen so many studies from right around the world. We've seen them in adults and adolescents, and some new studies in children as well. Now, the studies in children I particularly regard as important because, as I mentioned, the age of onset for these disorders is extremely young, and we believe actually the risk for these disorders may in part be related even to prior to conception. And this is an area of research that we're really focusing on in great detail now. But this study that I'm about to tell you about was really a groundbreaking study. It was actually supported by the Big Brain and Behaviour Research Foundation in the States. It's the largest philanthropic organisation supporting mental health research. And they funded me to go to Norway and to look at data that come from the largest cohort study in the world. So we had data from over 23,000 mothers and their children. And what we wanted to know in this study is what is the relationship of very early life nutritional exposures to the mental health of children. So we've known for quite a long time now that exposures in utero are linked to children's risk for later health disease, such as heart disease and obesity and things like that. So the environment in the womb and the environment in the first few years of life are very clearly linked to the risk for somatic disease later on. But no one had looked at children's mental health as a function of their nutrition. So we did that. And what we looked at as outcomes were what are called externalizing behaviours, which are children's, tantrums, aggression, anger, that sort of thing, and their internalizing behaviours, sadness and anxiety and crying, because these are behavioural markers that we can witness that tell us ability to mental health problems. They're linked to their risk for mental health problems later on as they get older. And we looked at this over birth to 5 years as a function of mothers' diets during pregnancy and also the children's diets in the first few years. And what we saw consistently was that mums who had more junk and processed foods during their pregnancy, the children had higher levels of externalising behaviours, not internalising but externalising. Now, importantly, this was independent of the parents' socioeconomic status, their education, whether or not mum was depressed or anxious, a whole range of factors, whether or not the parents were married, all those sorts of things. These seem to be quite independent, and importantly, it was independent of what the children ate in the first few years of life. There seemed to be a direct relationship between mothers' diets and the kids externalising. Now, very interestingly, 2 other studies have now confirmed this, showing again that mothers' unhealthy diet during pregnancy or low levels of unhealthy foods as well in the second study are also related to children's externalising. So this definitely seems to be a true association. Similarly, we found that children's diets really mattered. So the kids who had higher intakes of wholesome, healthy foods, they had lower levels of internalising and externalising behaviours. Those who had higher levels of unhealthy foods and junk foods had higher internalising and externalising. And one really important thing to consider with all of these studies where I'm talking about healthy dietary patterns, unhealthy dietary patterns, is that they're not just the opposite of each other. In fact, their relationship between the two is actually not very strong. So you can be high on both or you can be low on both. In fact, it's quite common for young people, for example, to be high on both. They're getting lots of healthy foods at home, they're getting fruits and vegetables, etc., but then they're also having lots of junk and processed foods with their mates after school. Conversely, older people can be quite low on both. So they're not having a lot of takeaway foods and processed foods, but they're also not having a wide range of wholesome, nutrient-dense foods. They may be just having, white breads and sausages. And each of these patterns is independently linked to mental health. And it seems to be that they may operate via independent but overlapping pathways. So this is something we're seeking to understand in more detail now. There's another study published at just after ours that showed too that mothers, this is in 7,000 mother-child pairs, followed up over a long time, very famous study this one, the LSPAC study, showing that women who had more depressive symptoms during pregnancy had worse diets. That's not surprising. We know that people who have depression and anxiety eat worse as a function of their symptoms, as I mentioned before. And both unhealthy diets during pregnancy and low levels of healthy diets, nutrient-dense foods, were also linked to the children's IQ at 7. And again, this was independent of postnatal depression, the children's nutrition, and a large range of socio-demographic and familial factors. So we do think that the diet that the child receives in the womb is linked to their brain development, their stress response system, a whole host of factors that influence their risk for mental health problems and particularly their cognitive functioning. Again, just to put this into context, this is likely to be very similar in the US. This was a study that was done in 2012 looking at a very representative sample of young children, 2 and 3-year-old, maybe 3 and 4-year-old, in South Australia, and from a wide range of backgrounds. They found that fewer than 20% of the kids were having enough dietary fibre. And again, that's very important for the health of their gut and then the immune system. Only about a third of them were getting enough omega-3 fatty acids, and that's very important for brain development, stress response system, a whole host of things. Nearly all of them were getting too much saturated fat, and already at this very, very young age, nearly a third of them were classified as overweight or obese. So these are just kindergarten children. These weren't a particular bunch of children. They were very representative of the population. So we can see that children are eating differently, and quite possibly they're also predisposed to weight gain because of the diet of their parents. And we can go into that in a bit more detail if somebody has a question about that later. Now, again, we know that dietary patterns have changed right around the world, and we know that this has had a huge impact on our health. We know that the NCDs, this is without even taking mental disorders and dementia into account, this is just the non-communicable disorders, heart disease, type 2 diabetes, etc. They will cost the global economy approximately $30 trillion by the year 2020, and there's no governments in the world that can afford this. Huge, it's a tidal wave of ill health as a function of the way we're eating. They had an emergency meeting at the United Nations in 2011, And there was a very clear consensus that the responsibility for addressing this tidal wave of ill health has to fall on the heads of government. And why was the reason for that? Because the problem is too big and too broadly based to be addressed by any single government ministry. The rise of these diseases has been driven by powerful universal forces, which is, of course, industry, and the response, therefore, must come at the highest level. Unfortunately, no government in the world has managed to address its obesity epidemic. That's because no government has managed to tackle the source of this epidemic, which is really industry. What we know over and over again is that getting individuals to improve their diet in the face of an obesogenic environment is very, very difficult. When everywhere around you, these unhealthy food products, I wouldn't call them foods, are being very heavily promoted. They're very cheap, they're ubiquitous, and importantly, they're really addictive. They're really addictive. If you look at studies done in animals, for example, you offer rats a choice between a sugar solution and a cocaine solution, and they will go for the sugar solution. If you allow them to binge on sugar and then you take it away, you'll see all the signs of drug withdrawal and changes in the reward systems of the brain that are consistent with drug withdrawal. So they're very addictive, these foods. So we have to change things at the environment level. We need to make these foods harder to get, more expensive, etc. So going back to the paper that we originally published in the American Journal of Psychiatry, it came with a very good editorial saying it's both compelling and daunting to consider that dietary change or dietary intervention at an individual or population level could reduce rates of psychiatric disorders. So really this is the next step. And there's been two very important, very intriguing studies. This is the one I'm going to talk about today. This was part of a big study that was undertaken in Europe over the last few years. The main results of the study were published in the New England Journal of Medicine. What they wanted to know was whether they got people to improve their diet, switching it to a Mediterranean diet, whether it would prevent heart disease in people who had elevated risk for heart disease. So they were overweight or they were smokers, etc. And what they found was that indeed it did reduce their risk. But colleagues of mine also looked at depression in this big study. And they found that people who switched to a Mediterranean-type diet seemed to be less at risk of depression over time. So it seemed to actually prevent depression in people, particularly if they had type 2 diabetes. So this is the first large-scale study where they've gone in and they've said, right, we're going to improve your diet and we're going to compare this to people who have just a low-fat dietary recommendation, which we now know is probably not the best dietary recommendation. And we found that indeed having a Mediterranean diet, which is, full of nutrient-dense foods, seems to prevent new cases of depression. But what many people want to know is, well, I'm already depressed. If I improve my diet, will I feel better? Will it improve my depression? We know that improving people's exercise behaviours is a very useful treatment strategy for people with depression. So if people are depressed and they start exercising, even if it's just going for a brisk walk once a day, that can really help depression. But we don't have any evidence of whether or not changing diet results in an improvement in mental health. So we're running the very first randomised controlled trial. We're looking at people who have major depression. They're being randomised to receive one of two interventions. One is a Mediterranean type diet, and in this they're supported by a clinical dietitian to make those changes in their diet, get more fruit and veggies, whole grain, good quality red meat, fish, etc. into their diet, and at the same time remove the sources of unhealthy foods that create inflammation, oxidative stress, that disrupt the gut bacteria, etc., from their diets, so the junk and processed foods, the high sugar foods, etc. In comparison, the other people get what's called a befriending protocol. So they go and see someone for the same amount of time that the intervention group get to see a dietitian every week. They'll see somebody to just talk about their day, their football team, their grandchildren, what have you, something that's equivalent so that you take out of the picture the influence of just going and talking to someone for a period of time every week or every fortnight. Now, we're recruiting for that trial in Australia, in Melbourne, and we will close recruitment the middle of next year. So it's got about another year to run, and we hope that by the end of next year we'll have some results from that very important study. This is for anyone who does happen to be in Melbourne. These are the details. Now, this is a really important caveat. At this stage, we don't have any good information to suggest that you can just take a whole lot of vitamin pills and expect them to be the same as having a healthy diet. It doesn't work that way. There's some evidence and some suggestions that some supplements can be useful in depression. Certainly, fish oil seems to have benefits for people who are unwell, for depression, bipolar disorder, and actually a range of psychiatric disorders. It seems that fish oil can be very helpful. But we also seem to see that there's some things in fish, apart from the fish oil, that are important. So it's possibly worth just ensuring that you have fish twice a week. No harm in taking an extra fish oil supplement, but you don't need to go overboard. In other supplements, we don't have any real evidence that they're helpful. There's some evidence that maybe taking folate or B group vitamins if you're unwell, as well as your normal treatment, can be helpful. And certainly zinc is something that we're very interested in. There does seem to be an emerging evidence base for zinc as a particularly important nutrient in depression. So that's something that can also be considered, but thus far our evidence is really just coming from animal studies, and that the science has not been done yet to show that supplements are helpful. But certainly zinc does seem to be something of importance. So for many people, they think that they can get away with popping vitamins and minerals instead of changing their diet, and unfortunately that doesn't seem to be a particularly good strategy. The WHO said years ago there can be no health without mental health, and this is really in recognition of the very important role that mental health plays in influencing the immune system and our risk for disease. But now we know that the opposite's also true. Our physical health has a big bearing on our mental health. So all of the recommendations for healthy living, getting some exercise, not smoking, trying to eat well and not reduce your level of overweight and obesity, are probably just as important for mental health as they are for physical health. I'm very, very happy to take questions now. There's many questions that people generally ask about, methods of how these relationships might be working, things that possibly we don't have answers for yet, but that we're looking into in great detail. And I'm more than happy to answer whatever questions you have. I hope that's been interesting. And as I mentioned, there's a lot of literature now on this. We're currently building a website that will have a lot of this information on the website so that people can go to it and get the information about this. If you Google my name, you'll see probably a lot of interviews and press releases and things around some of these studies if you want to know more. At this stage, unfortunately, we don't have the website built because, of course, these things are lacking funding all the time. But we're really very excited about the potential for disseminating this information and giving people the power to change their lives in a positive way by improving their diets and their exercise and stopping smoking. And indeed, there's actually some very interesting evidence just recently showing that when people stop smoking, their mental health improved. So often people don't stop smoking because they think they'll have withdrawal symptoms and they'll feel worse, but actually the evidence is that it actually made them feel a lot better. And of course it's an important source of oxidative stress and damage to the cells. So as I said, please ask questions. I'm very happy to answer them.
Great, thank you. The first question is, what is the one diet change that could be the easiest to implement? Which I fixed.
Ooh, I don't know. I think it depends on what people's current diets are like. I know our clinical dietitians work with a whole range of strategies. For some people, it's really making an effort to reduce the amount of sugar in their diets. Sugar is extremely addictive, and often you have to actually go cold turkey, a bit like giving up cigarettes, and really just have no sugar for a few days and really just concentrate on having good quality protein, such as fish, and good quality grass-fed meats and vegetables, and just not having any sugar at all. And it seems to get easier after you've gone through that withdrawal. That's one thing. The other for many people is just increasing the amount of fibre and vegetables and fruits in their diet. So, the recommendations at this point, vegetables every day. The new recommendations and new research seems to suggest that, the more vegetables you can get in, the more pronounced your risk of disease in a dose-response manner, up to 10 serves of vegetables a day. So getting those vegetables into you and the fibre, eating a raw carrot every day, just ensuring that the vegetables and fruits that you have going into your system are as unprocessed as possible.
Great, thank you. The next question, are there any particular foods that can help prevent bipolar episodes?
Look, we don't, unfortunately, have that information at this point. None of the research has been done. There's an enormous need for more research in this area. There's some intriguing anecdotal evidence from clinicians that some people benefit from removing grains out of their diet, or at least reducing them. Some evidence, but that would only be in a small percentage of people who have a food allergy to grains. But other than that, we really don't have any evidence to say one way or the other. I think the best strategy is really just working towards improving your diet overall and improving your physical health and reducing your weight, and certainly all the other strategies in bipolar disorder, such as going to sleep and getting up at the same time so that you have that rhythm in your diet, getting enough sleep, rhythm in your day, not your diet, eating meals at the same time, having a structured timetable that really helps your body to take on a good rhythm, circadian rhythm during the day and during the evening. A good diet and some exercise fit into that strategy very well. And in fact, for many people, preparing fresh meals can be an important part of their routine that helps them to feel calm and in control of things. These eating this way doesn't need to be very labour intensive. If you have frozen fruit, vegetables, that can be a very useful way. Frozen vegetables are often cheap. They're very easy to prepare. They're already cut up. You might just have a good quality piece of meat or fish and some frozen vegetables and a nice sauce to go on it, and that's a meal, and it's very simple to prepare. But preparing that meal can be part of, having a rhythm and a routine during the day.
Excellent, thank you. The next question, can omega-3 supplements address acute depression and anxiety?
Look, there's some good evidence that may be the case, yes. So certainly they're not going to be harmful as long as you're not taking them at very high doses. You don't seem to need a lot. One or two of these, between 1,000 and 2,000 milligrams a day, seems to be the recommended dose from the studies that have been done. And they do seem to be helpful for a lot of people. There's a lot of reasons for this. A lot of the underlying pathophysiology of psychiatric illness relates to immune dysfunction, what's called systemic inflammation. This is when the immune system is kind of inflamed when it shouldn't be, and the related oxidative stress, where you get this level of reactive oxygen species that create a lot of damage in the cells. And omega-3 fatty acids address that inflammation and sources of oxidative stress. So having a fish oil capsule a couple of times a day is probably a good idea.
Great, thank you. The next question, are there differences in the relationships between diet and unipolar versus diet and bipolar depression?
No, not as far as we know. Nor, in diet and any other health and disease. The only caveat I would say to this, and this arises from a very interesting aspect of the study that I did with my PhD. I was brought up a vegetarian. I had eaten pretty much a vegetarian diet most of my life, and I hypothesised that red meat and meat products might be associated with worse mental health. Now, very intriguingly, we actually found, I wouldn't say the opposite because it's a very U-shaped pattern, but what we found was probably the strongest correlate of mental health, and this included bipolar disorder as well as unipolar depression and anxiety disorders, was that consistently people who were having insufficient meat intake, so not vegetarians, we took them out of the equation because that can be a strange bidirectional relationship there. But people who were we looked at people according to whether they were less than or more than or in the healthy range of red meat intake according to the recommendations. This didn't apply to fish or to chicken or any other sources of meat. This was red meat. Now, in Australia, red meat is generally pretty healthy because it's grass-fed. In the US, it's far less healthy because it's usually coming from feedlots. So I would make the important distinction there and suggest that this is about grass-fed meat. But we found that those who are having the recommended intake of red meat, and this is 2 or 3 small portions a week, maybe the size of your palm, over the course of the week, so not just all in one go, but over the course of the week, that seemed to be associated with a halving in the likelihood of having depression, bipolar, or anxiety disorders. Whereas those who are having less than that, or those who are having a whole lot more than that, seem to be twice as likely to have these disorders. So it seems to be that good quality grass-fed red meat, not in huge quantities, but over the course of the week, in 2 to 3 servings a week, seems to be important. We don't know why. Part of the trial that we're doing, we're seeking to really look at that in more detail. We think it's probably related to people's zinc status. Again, I mentioned that zinc seems to be very important in psychiatric illness and depression, but we're seeking to understand that in greater detail. So I guess if there was one recommendation I would make is that you find a source of good quality grass-fed red meat and try and have a small amount of that 2 or 3 times a week.
Wonderful. Next question. I work in the mental health field, and most people are on a very fixed income, and I'm wondering how to best encourage them to change their diets. Also, how do we encourage food banks to have healthier food choices for these individuals?
Well, that's the multi-million-dollar question, isn't it? It's very interesting, actually. One of my PhD students is a clinical dietitian, and of course she hears this from her clients, and including those participants in our trial with depression, who say, but it's so expensive to eat well, it's so expensive. So she spent many, many months in great detail, really enormous detail, costing every single individual food item that people ate, and looking at what they ate when they came into the trial, which was generally high levels of unhealthy foods and prepackaged foods, and then comparing it to the recommendations we were making. And she found, in fact, that it can be cheaper to have a healthier diet than having an unhealthy diet. Now, of course, it very much depends on the choices you make. If you go for, the best quality organic, what have you, you're going to spend a lot of money. But if you take tinned products such as tinned legumes, very cheap, tinned tomatoes, tinned vegetables, if you have frozen vegetables, also very inexpensive, already cut up, these are actually nutritionally equivalent. You can eat very cheaply and well by avoiding processed packaged foods, which are not free, and just doing a little bit of basic preparation. So if, for example, at a market you were able to get a good quality cut of meat and you used the whole piece to make a stock and some good vegetable soup with vegetables and meat, etc., and legumes, you could eat that over the course of a week very, very cheaply. So some of those strategies around the choices that you make at the supermarket, Jamie Oliver, I don't know if he's really big in America, but huge here in Australia and over in the UK, really advocates a whole range of strategies for making food cheaply and easily without spending a lot of money. And, of course, going to grocers rather than the supermarket, going to markets rather than the supermarket. These can also be really good strategies for getting food cheaply. But if you utilise legumes, so that's, chickpeas and lentils and different sorts of beans, very, very cheap source of good quality protein, fibre, minerals, etc. Vegetables from markets using frozen vegetables, etc. You do not have to spend a lot of money to eat well. Certainly grass-fed beef will set you back a little bit, but you don't need a lot of it. We're really talking about maybe 300, 400 grams over the course of a week. It's not expensive. You can use tinned fish, which again is cheap. So there's ways of eating well that don't cost a lot of money.
Great, thank you. The next question. In the middle of a depressive episode, getting regular exercise is a daunting task. Do you have any suggestions as to how to go about changing your diet during such a period?
Look, it's very, we thought that it was going to be harder than it's turned out to be to get people during a depressive episode to improve their diet. The clinicians, the dietitians who work on our trial were really worried. You know, people obviously have a lot of fatigue. They feel really unmotivated, all of those things. But we've all been very pleasantly surprised at how willing people seem to be to try and make those changes. And I think it comes down to a feeling of, well, at least this is something that I can do for myself to improve things. So many people, the factors that feed into their depression are things that are outside of their control, things that have happened to them, life events, circumstances that they feel powerless to change. Diet is something that they can change, and it may just be getting up or asking a friend to take you to the supermarket and help you do a healthy shop. Maybe engaging friends and family and helping to make a good healthy stew at the start of the week so it's in the fridge ready to have when you're not feeling motivated to cook. Getting a friend or a family member to come with you for a walk, just a short walk every day, just to get outside and get moving. These are all strategies that seem to help people and actually help by making them feel that they're back in control. You know, that sense of self-efficacy and self-volition is very, very important in improving our mental health. And taking those small steps can make a very big difference to our mental and physical health. And they don't need to be huge steps. You don't need to go out and do cooking classes and whip up 3-course meals. You can do it very simply. And, of course, engaging friends and family in supporting you or a healthcare worker can really make a big difference. A lot of the community centres, etc., will have cooking classes or shopping classes, and they can be worthwhile tapping into if one has the energy to go and do that. But again, it's around feeling self-empowered, and people seem to really welcome the opportunity to do something that puts them back in control.
Excellent, thank you. Next question, what are your thoughts on coconut oil? I hear it is very important for a healthy brain.
Yeah, that's a really interesting one. I don't think that the science has really caught up with the thoughts around this, but I think there's some very good reasons to think that the saturated fats, as opposed to the polyunsaturated fats, can actually be a good strategy because, again, it's linked to this idea of oxidative stress. Oxidative stress, a lot of people will hear about it. We all know what antioxidants are or what sorts of foods have antioxidants. Antioxidants are things that combat oxidative stress, and these are basically molecules in your body that cause cellular damage. They damage your cells, and they seem to be very important in psychiatric illness. And indeed, when people are having a depressive episode, a manic episode, levels of oxidative stress in the body are really increased, and they're doing a lot of damage. You're doing a lot of damage to your body and your brain. It's one of the reasons why fish oil can really protect your brain from the damage of oxidative stress. Fruits and vegetables can help to protect because of their high levels of antioxidants, etc. This is really pointing to why eating well is important. I've forgotten the original question, Debbie. Can you point me to it again?
Oh, sure. It was regarding coconut oil. Has there been any?
Oh, that's right.
And if so, amounts to take?
Yeah, interestingly, when you have polyunsaturated fats, so these are the vegetable oils, there's more, it's a bit biochemistry related and a bit difficult to explain, but there's more of the fat to oxidize. There's more of the fat to oxidize, and this results in oxidative stress. The saturated fats don't have as many components that are able to be oxidized. The body seems to use these saturated fats. So this is getting back to this idea of the Paleolithic diet, this idea of what actually are we genetically designed to eat. And there does seem to be evidence that coconut oil, which of course people in tropical regions of the world have eaten in great quantities since whenever, and animal fats are not the baddies that we've thought that they were. And that doesn't mean to go out and have huge quantities of them, but it does mean that it seems to be the body is actually designed to use these substrates, these fats, for a lot of its processes. I certainly use coconut oil. I use it for cooking because if you use polyunsaturated fats for cooking, the heat creates these oxidative molecules, whereas that doesn't happen with coconut oil and other forms of saturated fat. They're not affected by heat to anywhere near the same degree. I have coconut oil in a few of the different things I would eat over the course of the day, and there does seem to be some evidence for it, although I'd say that the science is yet to catch up with the thoughts around this.
Great, thank you. It looks like we have one last question. Has there been any research on specific chemical additives which are being added to food?
Yeah, look, that's a really good question, and the short answer is no, not really. So it's a whole other area of research that is yet to happen. We initiated the International Society for Nutritional Psychiatry research in recognition of the fact that we need to get more people doing research on these topics. We really hope that the big philanthropic bodies will fund more nutrition-related research, and that's certainly one of the questions that a lot of people have. I would suggest at this stage the science would say that the foods themselves are more problematic than the additives, but we don't know for sure because no one's actually done the research. So we need to do more research to find that out. But it's a very good question.
Great, thank you. Well, I just want to remind everyone that this webinar has been recorded and will be archived on our website for future viewing. And thank you so much, Dr. Jacka, for being with us today and sharing your insight and information. We really appreciate it.
Look, it's been a great pleasure. Thanks so much, Debbie. Much appreciated.